record. Let me record. Please ask the host to give you permission to record.
I'm recording. I went ahead and
Okay.
record. So if you could
Okay.
start over with your introduction, that would be great.
Okay. Sorry. So like I said, I'll go first. My name is Erica. I am from the San Antonio Water System with the Uplift program. I'm a specialist here. So if you have heard about the Uplift program, I'm probably one of the agents that you have spoken to. We do have other representatives as well. So we do from talking on the phone to helping with the application to putting those funds actually on your account. So if you're not familiar with the Uplift program at the San Antonio Water System, we help with your water bill. So we do have all of the programs now in one. So in 2020, we changed over all of our programs to be one application. It does help you for 3 years. So the main thing to go to, so I'm going to talk about the programs a little bit, and then I'll let y'all know where y'all can find that application. So our programs are 6 main programs. Let me get my little pamphlet out. So the first one that we help with is the affordability discount. So this discount provides you a discount every month off of your bill. Just like if you were going to HEB and you had a coupon at the end of the bill, it would take it off. So that is what the discount is. Our second one is the Project AWA funds, which a lot of people are familiar with. So it does help with $115 twice a year, and it is payment assistance once you're in a final notice. We do have our disability and disability veteran program. So that is one that, a lot of people can get enrolled into. So it gives you an extra 10 days off your bill. So some are, only get a check per month. That is going to help you kind of even out maybe, getting those extra days for you so you don't get any late fees within those 10 days. And then we also have our Plumbers to People program and our Laterals to People program. So those 2 services provides free plumbing assistance and sewer assistance for homeowners. And lastly, it's more of a benefit now, but it's still a program as our senior program, which gives you no late fees after the age of 60. So those are the main programs that we do offer. And where you can do to go to this, I'm going to share my screen really quick. See which screen it will let me do. Okay, 2. There's just so much stuff up. Let me see. Here we go. Okay, so everyone can see that, correct?
No, it's you.
No?
No.
Okay.
Screen sharing going.
Oh, here it goes.
Okay.
There, you can see it now.
Yes.
Okay. So you can go to SAWS.org, or you can go to uplift.saws.org. Okay. So this will let you know all of our benefits, about our program, how to donate, and a little bit more about our team. So you can go here. So if you go to I need help, you can go there. It's going to let you know the income qualifications. And then here you would log in with your SAWS information. So where you can see your bill online, you would log in with that information. And I'll kind of just type mine in here so y'all can see that. And 2, we have representatives. If you don't have online, you can call our phone lines and we would help a customer over the phone. So you would just sign in here to apply. So these are your 3 tabs up here for your billing information. This is just an example of one. So this 3rd tab, you would go to Uplift, or if you're on your phone, this is kind of going to be like down, like in a scale form, and this very top will be on your phone. So if a customer goes from their phone, just let them say, look for that Uplift name. You can either press here or you can press on the tab. So here is all of the programs that I kind of talked about: the affordability discount, the disabled, the disability billing. So no matter which one, you can actually just start on it, apply now, and then start the process for the application. Once you're done, it'll let you know which program you're eligible for. So let me see if I have a customer. So I think I have a customer I helped apply today. So this would show it pending. Once you're done with the application, it's going to let you know it's pending. We're reviewing it as of the 16th. So that is pretty much it about the SALS Uplift program. So let me stop sharing. Okay. And I just wanted to let y'all know, about the program. I am here to help anyway as well.
Awesome. Thank you. Now, for those of you guys listening in, if you have any questions, feel free to ask. You can either come off of mute to ask your questions, or you can put them in the chat box.
And I'll let you know our phone number. So if y'all do have questions, maybe you didn't want them to be too public, our phone number is 210-233-2273. And we're open just 8 to 5. We take lunch to 12 to 1. You can answer, or you can email us at uplift@sals.org.
Well, if there aren't any other questions, we'll go ahead to the next presenter. Keith, would you like to go next? Richard?
Hey, all right. Can you hear me?
Yes. You're a little bit low.
Am I?
Yes.
Okay. How's that?
That's fine.
Okay, great. All right. Well, thanks for having me. And this is really exciting. Thank you very much to Disability SA and everyone who helped to put this on tonight. It's a really important conversation. So I work for the city's Department of Human Services, and we have been very active during the COVID-19 pandemic, trying to help folks to maintain their stability to the greatest extent that we can during the COVID crisis. So, a lot of folks have been financially impacted by COVID. Many people have either lost their job or have lost a lot of hours related to their job. And so they were in a really terrible situation, some folks right away. And so we've been working with other departments in the city, including the Neighborhood and Housing Services Department, which is also represented here tonight as well, to open a new center. And the new center is called the Financial and Housing Recovery Center. In this center, we're able to help residents to identify other resources. And sometimes folks come to us not knowing what resources they're even looking for. Sometimes they just say, well, I am in a financial situation that is terrible right now due to COVID, and I don't know what to do. And so we start to do a little assessment with them. Our benefits navigator team, which is what we're calling them, benefits navigators, can help them to, after we assess them, to identify what resources are there in the community. These could be state, federal, local services, nonprofit services, the San Antonio Food Bank, all kinds of different things, and which ones might be most relevant for the person's situation. These benefits navigators can also help folks to answer any questions that they have about the applications for these other services. We started doing this work, for example, because some folks were trying to complete the application for unemployment benefits, but they were finding that as they were filling out that complex application, that the application was getting kicked back, that they hadn't submitted everything that they needed to, and they were sometimes getting notices that they did not understand, and they couldn't get a hold of someone at the unemployment office to ask their questions. And so with this team to be able to help folks to identify answers for their questions and keep those applications going so that they can successfully complete the application, and if they're eligible, that they can get that assistance that they're seeking. So that's true for SNAP food benefits. It's true for unemployment. We can help to point people toward job training supports, toward subsidized childcare assistance, toward Head Start for early childhood education, for financial counseling, for CPS energy utility assistance, for SAWS utility assistance, which you just heard about a few minutes ago. So these are activities that we're doing right now. And the other thing I will just mention is that another service that we're trying to make sure that the public is aware of right now is the VITA Free Tax Preparation Program. So this is an income eligibility program where if you are eligible, we can prepare your taxes for you for free. And this is especially important if you have not completed a tax return for the last couple of years for whatever reason, like maybe you weren't, you didn't have a tax liability, so you didn't submit a tax return, which is legitimate, that you may not have needed to. But you may also be eligible for a stimulus payment that the U.S. Treasury Department was not aware of you for, and we want to make sure that you're on their radar as applicable. So those are some of the things that we're doing right now, the Department of Human Services. And as I mentioned, we're working very closely with the Neighborhood and Housing Services Department. And I believe Annabelle Villa is here representing NHSD, or Neighborhood Housing Services Department, NHSD, tonight as well. So any questions that you have for me or for Annabelle, please go ahead and enter those in the chat. We want to make sure that we address those if we can. And thank you.
Thank you. Okay, so we do have a question, but it's going to be for SAWS for Erica. Erica, the question is, I have heard rumors that SAWS and CPS Energy are not going to forgive past due and higher rates that they are charging due to the pandemic and snowstorm. Instead, they are passing it on to ratepayers. As a person with a disability, I rely on my electricity and water. What is being done to make sure people with disabilities aren't affected by this for those on SSI and SSDI that need these services for personal and medical reasons?
Okay. Yeah, that was a kind of a lot in there. You're popped up. Let me see. Where did you go? Oh no. I lost you. Can you hear me?
Yes.
Okay. I don't know where this went. Okay, there it goes. Okay, I'm sorry. So there was kind of a lot in that question. Okay, I heard rumors you are not going to forgive past due and higher rates. So I'm not exactly what that kind of means. So what we did for the snowstorm is all the bills that happened after the snowstorm. We actually gave customers their last month's usage bill. So if their bill was $50, we went back and billed them for $50, even if their bill usage would have been in the hundreds. And that did happen. That we did make that change. So nobody in February and those newborn bills in March got those big payments because of the snowstorm. I don't know if there is going to be a forgiveness program with that. I have not heard of anything yet, but doesn't mean that something will happen. So we're not passing any of the bills off. We definitely have the program Uplift to help with some of those past due. And right now we're not turning off services at this time. So we're anytime we talk to a customer, we're being very open. Like if you were able to work anything out, we're giving other agencies, we're using our programs to help with those payments and anything. So let me read the question again too. Instead of passing it on to ratepayers on electricity and water, to make sure they aren't being affected by this. So again, we do have the Uplift program for our customers with disabilities. So it's kind of a lot in that question. Again, I don't know how to quite answer some of that. We're not going to be turning you off. And the snowstorm, again, we did not pass any of those. We did not give those high bills out. We went and said, those bills will be that bill will be forgiven. I've seen customers' bills where they could have had a huge bill, and we went back and we only charged them $40, $30, whatever their past amount usage was. And so if you haven't got into the Uplift program, I would strongly, if you have time to apply for that. If not, you can call us. If you don't have internet or a phone available to apply online, we can definitely help you. So if there was something, if you have a bill question, we can answer that more thoroughly for you, exactly what your needs are going to be for your bill.
Okay. Thank you so much, Erica, for tackling that. So,
yes.
Yeah, you did a great job. So we'll move it on to our next presenter, Ms. Annabelle, if you want to go ahead and introduce yourself. And I believe there's a few questions for housing.
Good evening. My name is Annabelle Marroquin Villa. I'm with Neighborhood and Housing Services with the City of San Antonio, and I'm the manager for the Emergency Housing Assistance Program. Currently, we've assisted families with rental, mortgage, and utility assistance. We've actually spent over $88 million since the pandemic started. So in 2 days, it'll be our 1-year anniversary that we've assisted families in our community, as well as Bexar County, with rental assistance and mortgage and utilities. So we have a big team here in the city. We are currently located at Central Library, where we have over 70 staff members that are processing these applications for this project. We currently assist those families that are under the 80% AMI. We ask for tenants and landlords to certify to make sure that we are actually assisting them in every way possible. If families are facing foreclosures, we have housing counselors that are actually assigned to these families so that we can work through the loan modification and foreclosure. And I mean, some families are in arrears up to $15,000 regarding their mortgage. So we're able to assist up to 9 months for their mortgage and arrears. So we're very busy. busy since day one, and we are more than happy to assist in regards to qualifications. If you have any questions regarding that, please feel free, put it on the chat. I can also put my email address in case you have questions in the future, or if you need some type of answer in regards to a family that you're assisting. You can also call our Fair Housing call center, which is 210-207-5910. We have a call center that is answering any type of housing needs. And we also provide referrals, as Richard mentioned earlier.
Yes. Are there any phone questions for the participants on the phone? Okay, well, I'll go ahead and
And I forgot to mention one thing. SALS does actually have a program right now for after the snowstorm. If you did have broken pipes, or your water heater did get broken, anything, in the home that it stopped working because of the snowstorm, we do have a community plumbing repair program. And you can actually apply at sals.org. It should be on the front page, and it's called CPR. And you can also be a renter for that program to get free plumbing assistance. I forgot to mention that.
okay. So a question just came through. Let's see. So this question in the chat basically is just asking, could the county consider doing a homestead property tax freeze as opposed to a percentage deduction on property taxes for the disabled? They say they love their home, they don't want to give it up, it's completely paid for, but at some point in the future, I will have to sell my home, and if my family cannot help me with property taxes, my taxes are $6,000. My very first disability exemption took $500 off of my taxes in 2019 compared to 2018. However, my home value went up $9,000 in the last year, and now my taxes for 2020 are even higher with the disability exemption than were without in 2018. And my SSDI, however, will not increase. Is there anyone who can tackle that question?
That's a doozy. That's a pretty hard question to answer. I don't know if there's anybody from Bexar County here, like from the appraisal district.
Yeah. I personally, if there is, so you can dispute your increase. I do it every year with my home. So when you get your paper for the increase, there's a fly, I'm sorry. For your increase, there's a dispute letter on the back. So if you haven't disputed your increase taxes, you have, I believe, till May 15th. So if you haven't done that before, that's also a good tool to use at your advantage.
Okay, thank
I would
you.
also say, if I could just say one more thing about that. I'm not sure that any of the three of us as speakers are able to address that question very directly. But I would say that if someone if someone is out there who is in this kind of a situation, we would love to have the opportunity to talk with you about your individual situation, to see if there are maybe other resources that we might be able to connect you with that pertain to your situation. So if you're having trouble with your property taxes, maybe you're having trouble with other things. So, with your rent, with your utilities, with other things. And I think there may be something that we can help you with that is not directly related to your property taxes, but is in another part of your budget, let's say, that could help to provide some relief possibly. And so I'm going to give you our telephone number, which is 210-206-5372, that you can talk to, so that you can potentially talk to a benefits navigator. You can also contact 211 or 311 311 actually has a good connection to us and can get you over to us, but either 311 or 210-206-5372. Thank you.
Thank you so much for answering that. And so for Annabelle, one of the questions also that came in is, are there any additions to current efforts or programs to provide further care at residents of people with disabilities? The pandemic has drawn out this demand, and plus some disability patients are at higher risk of infection due to the nature of their condition.
Sorry, I'm reading the question.
Okay.
Are there any additions to current efforts or programs to provide further care to residents of people with disabilities? I'm not sure. I mean, I currently work with a rental assistance program. I mean, I know with our program, we try our best in case there's applicants that have a disability or are in need of assistance, you know, they're not able to upload their documents for a rental assistance application, then we do provide the assistance for them to come to the Financial and Housing and Recovery Center that Richard mentioned earlier, so that we're able to better assist them in applying for assistance for, you know, rental and mortgage, as well as uploading all those documents. If there's anything that we can do, we also send a paper application to those the community that is not able, does not have easy access to their telephone and, you know, fill out an application online. So those are some of the things that we do provide for those that are disabled or elderly. And so we're trying our best. I mean, we also provide a lot of resources. There's a lot of seniors that do come into the recovery center and they're needing food. And so we do make those referrals as well.
Okay, perfect. Now, we have less than 5 minutes remaining in this room, and we still need to get to Miss Anna with Texas Rio Grande Legal Aid. Would you like to go ahead and start speaking now? And I do know that we have another breakout session a little bit later, so we can provide you some more time to speak then as well.
Okay, can you hear me?
Yes, perfect.
Awesome. First of all, thank you for having me. So I manage the San Antonio office of Texas Rio Grande Legal Aid. I also work as a magistrate on the weekends for the city of San Antonio. And so one of the things that strikes me is that digital divide is a huge, huge issue. If you don't have access to the internet, then you can have all these resources, but you can't really, you don't have enough assistance to really access those resources. And I can give you some examples. Like I work with a driver's license restoration project and ID recovery project. And one of the problems that we have is that during this time, during the COVID period, the agencies are shutting down and they're not as available, but they are available on the internet. And so if you don't have access to the internet, for example, the Department of Public Safety, they're not answering their phone. And they're pretty much shut down. And so the only way to try and get your driver's license back is if you have internet access and you can go online and find out what the problem is with your driver's license. So if you don't have access to the internet, then you are shut out of a lot of things, even when it comes to like just trying to set up your immunization. And I noticed that the city's going more to telephone access, which is good for setting up appointments for shots. But everybody was fighting on the internet to try and get the slots to get immunization. And so other people were shut out, in particular, people who are disabled. So there's lots of issues. I would like to see better access to the internet for the disabled or for people who need it. I mean, I work downtown, and a lot of times what I see is people are at the McDonald's sitting in the parking lot and they're homeless. And so they don't have anywhere to access the internet, but McDonald's has the internet. So they're sitting outside the McDonald's trying to get access to city services or to, try and find a job. You see that quite often. And so if there was just like more areas where there's free internet access so that people who don't have that can access all the wonderful services that we have here in San Antonio and all the social service agencies. I think that would be, extremely beneficial. But when you talk about agencies that are, somewhat shut down during COVID, the only way to reach them really is during the internet and the, access the resources that they offer. So that's one of the things I've noticed on very often. When I work as a magistrate, what I notice is that there's this whole population of homeless, disabled individuals. And it's like there's so much help for other people, but it's hard to reach that one population. And it's really hard to see these people move through the system. And there's like a lot of people who don't have a lot of empathy. And so even when it came to like trying to get them to give these people who are, picked up for different things and were being held, to give them a mask, so that when they were magistrated, they're standing with a bunch of other people, they weren't infecting anyone or themselves or getting infected. And, the jailers had this attitude of, oh, you don't know these people. And I'm like, what? They're human beings and they need masks and you should give them. Oh no, they're just going to throw them on the ground because they have mental health issues. It's like, it's craziness to see that. And it took having to go to a city council person who then went to McManus, who said, okay, these people are going to wear masks. And even after that, when we would magistrate, the jailers would say, well, they're just going to, I said, they don't have a mask. And I said, and they would say, oh, well, they didn't want one. And I said, okay, so McManus ordered that they would have a mask. And you're saying you're not going to give them one. And I'm telling you that they need one to be magistrated. And then they kind of backed down after that. Everything's being videotaped too, right? It's all on videotape. So it's very sad to see disabled people go through the jail system because there's not a lot of empathy and there's no watch guards except, once in a while we magistrate, which we only see them for a few minutes, but we don't see what happens after that. So it kind of bothers me to see all these homeless people who are going through the system and there's not really anyone there to support them. And I'm not sure how you remedy that issue, but it's a huge one.
I agree. It is an issue we need to tackle, and hopefully we can continue that conversation, in just a little bit. I know in the interest of time, it is time for us to go to our next room, or to our next group. But you definitely brought up some really key points that we need to look at for people that have disabilities and are going through the system. So that is one that we do have recorded down here. So thank you for bringing that up. So now if you all can just navigate back to the main room and then we can go into our next breakout session.
Shanti,
yes.
For those of us who are presenters, should we just stay right where we are?
Yes.
Okay, great. Thank you.
Mm-hmm.
My name is Paulina Lewis.
Hi, Melanie. I had a question. I'm from the transportation room, and so far we don't have anyone in that room. So we were going to wait until about 7:10. But what should we do in the case that no one shows up?
Okay. Have y'all gone through the questions and answered them, and we've recorded your responses and everything?
Yes, in the first
Okay.
session.
Okay, so give it just a few minutes, and if nobody joins your room, y'all are certainly welcome to go because we've captured the data and we can share that. Or you're welcome to go join some of the other discussions if anything is of interest to you.
Okay, thank you.
Thank you.
And this is Shauna. I'm in the shelter housing room. And so we ran out of time, but it was a pretty good discussion. And so we were just going to pick back up where we left off when we go back into the breakout room again.
Perfectly fine.
Okay.
Did you need me to put you back in? No, I can't put you back there. I think you can rejoin if you click on the breakout room button.
Oh, I thought at 7:05 we came back to the main room. So we had paused everything to come back to send everyone back to the main room.
So people can self-navigate. I can move you to a different room and then move you back into shelter and housing. But if everybody just wants to stay in there, nobody has to leave.
Oh, okay. So, yeah, we didn't know. We just, yeah, I guess
No
me and the
worries.
report assumed
Okay.
that, yeah, we needed to push everyone back to the
So-
main room. So we need to go back into the shelter room.
Yes, so especially because you're the moderator, so you'll definitely want to be in there. If Angela, I think you already got one new person. Eva changed rooms, and I'm not sure if Angela did or not, but if you can you self-navigate back in there, or do I need to
Let's
help
see.
you get back in there?
Let me see if I can find my name and push me back over. You may have to push me back over. I don't see my
Okay.
name on the list.
So what I need to do, I'm going to put you in a different room, and then you'll see an invitation to go back to room 1. Okay.
Okay, sounds good.
And you'll do the same presentation all over again for the new people in the room.
Okay, and then are we the ones, my support is asking, are we the ones putting the other people in the rooms, or are they just kind of going by themselves?
They go by themselves.
Okay,
So if they want to switch rooms, they can come back to the main room, or they can self-navigate to the other rooms.
okay, so we can continue the conversation and everything?
Yes, ma'am. Yes, ma'am.
Okay, sounds good.
Keep that record button going.
Okay,
Okay, hold on just a second. You're going to see 2 invites.
Program. Actually, it was an idea that was being worked on prior to COVID, but since the COVID has happened, you know, it's all COVID all the time, and so it's now become right to counsel specific to the special circumstances people facing eviction have, the special rights they have under the Center for Disease Control, the CDC order. There's an eviction moratorium you may have heard about. Folks, there's money available for rental assistance. There's this thing called eviction diversion program, all designed to keep people in their homes rather than having them tossed out in the streets because they can't pay their rent because COVID has caused them to lose their jobs or lose income. And so the Right to Counsel program is a partnership with the city and TRLA, and I just put up here on the screen. I think if we can enlarge it. I don't know if you can see but if you do a Google search of Right to Counsel, City of San Antonio, or San Antonio Right to Counsel, you come up on this page, and it has links to the intake form. If you're facing eviction, you can pull up this form and you'll see the kind of information we need. You can email the Right to Counsel directly, or you can call and be my good friend Molly Wright, I believe, would answer the phone, and she's a formerly homeless person herself, so she's very compassionate, very effective in her work. So his phone number, email, and the form. And we encourage you to. I know Anne had stressed the difficulty of the digital divide, and unfortunately, that's just for now what we got to work with, because our offices are not open to the public and won't be until, I believe, September, right? If then. With apologies to those who lack internet access, this is the best way to get a hold of us. If you don't have internet, you can call 210-212-3703, and they'll walk you through the intake process. But that's basically, if you're facing eviction, if you're low income, if you have, we're here to help you, guide you through the process and assert your rights under the eviction moratorium. So let's see if I can exit this. Okay.
Well, I could go next if you like. in the interest of time, so my name is Richard Keith. I work for the city's Department of Human Services. And the Department of Services has been working with the Department of Neighborhood and Housing Services to help folks who have been financially impacted by the COVID-19 crisis to get connected to resources that can help to stabilize them financially. So for our part, we have hired a team of benefits navigators who are helping residents to get connected to all kinds of resources. As Enrique mentioned, and as you all know, there are a lot of folks in the community who have lost their job or have had their hours cut, have had their income cut, and are having trouble making ends meet. And so some people are trying to apply for unemployment. Other people are trying to figure out how to pay for their rent or their utilities or to get food to put on the table. And if you don't know, if you or someone that you know don't know who to call or what resources are available, you can call us and we will help to assess your situation and work to connect you with the resources that best fit your situation. We can help with applications if you are trying to fill out an unemployment application or you're trying to fill out the city's housing rental assistance application. We can help with those things. We can help to connect you to the food bank resources and to childcare and other things that may help you. And so I'm going to give you a telephone number. First of all, you can just call 311 and tell them that you'd like to talk to a benefits navigator. But you can also contact us directly at 210-206-5372. The city is also helping folks with their CPS energy bill. And so we can provide income eligible residents with up to $400 in assistance toward that bill as well. So we would love to talk to you about your situation and see how we might be able to help you. Thanks very much.
Thank you.
Do you want to go, Annabelle?
Sure.
Okay.
Good evening. My name is Annabelle Marroquin. I'm with Neighborhood and Housing Services Department with the City of San Antonio. I am the manager for the Emergency Housing Assistance Program. We currently assist families who are in need due to COVID. We assist them with rent, utility, and mortgage assistance. And so currently we have spent over $88 million in all these services for our community here in San Antonio. If the community has any questions regarding the rental assistance application, they're able to call our Fair Housing call center. It's 210-207-5910. Any type of status update, then we are able to give. We, at this moment, we're helping a lot of families who are homeowners and are going into foreclosure or in need of rental assistance. So we provide both services. We will provide that mortgage assistance along with assistance with the case management of a housing counselor so that they can be provided that information. They'll negotiate with the banks to do loan modifications and any type of assistance that the family might need. They are in need of an advocate, so they will, we will provide that service for them. Let me know if you have any questions.
Okay.
Thank you, Ms. Marroquin. We had a request for the number to be repeated for SAWS, I believe.
Our number is 210-233-2273.
Keith, and could you go ahead and repeat your number as well too?
So if anyone would like to contact a benefits navigator so that we can assess your situation and help connect you to resources, our telephone number is 210-206-5372.
And Miss Model Queen, was there a phone number, Model King?
Yes, it's 210-207-5910.
Thank you.
All right. So my name's Erica, and I'm from the Uplift program here with the San Antonio Water System. So I'm a specialist here. So we help with the water because, you know, water is definitely a necessity to everybody. So if you're, you know, going maybe through some maybe difficulties, or, you know, just that bill has, you know, you have questions or anything, you're more than welcome to contact us and see what our program offers. So we do, so the Uplift program has all of our programs in one. So the 6 big programs that we offer is the affordability discount, which is a discount every month off of your water. So that could range from $4.90 up to $28.35. Project AWA funds, which is payment assistance up to $115 twice a year towards your water bill. We have plumbing assistance and lateral assistance, which is actually free services for your plumbing and sewer. We would send out a plumber to your property. The only difference with that one, you do have to be a homeowner for that program. And then we do have the disability program and the disabled veteran program, which would give you an extra 10 days for your water bill. So now we do have 14 initiatives that come with that, from things like getting you on the Water Smart program, a courtesy hold, payment arrangements. If your water was to be turned off, we would lower some of those fees, like your deposit and your trip fee, which right now we are not disconnecting as of right now due to the pandemic and the snowstorm that did hit San Antonio all over, really. So to apply for those services, you can call us if you don't have online access. So our number again is 210-233-2273, or you can email us at uplift@saws.org. That's SAWS.org. And you can inquire that way as well. I'm just going to share my screen really quick to show you our online website. Okay, so here you can go to saws.org/uplift, or you can type in uplift.saws.org. So here is going to show you the home button, I need help, or if you would like to donate to the program, the program information, the benefits that we provide, how to help, and also about our team. Now, I also did not mention this last time, but we also have our agency listing. So there are agencies in the San Antonio area. You can actually go here and get some additional help. So to apply for that, you would just go to the homepage, I need help, and it's going to let you know the discounts, and then you can either register for your SAWS account, or if you already have one, just go to your SAWS account. So your SAWS account is, anything, if you already have a bill online, if you want to check your balance, anything pertaining to your SAWS bill. So you would just sign in. I'm just signing into an example one for you. And this is also, you can do it from the comfort of your home, from your phone as well. So if you don't have internet access or a laptop or computer, you can also do this by your phone. So here it, of course, should show your bill, my use, uplift. So if you're on your phone, these 3 tabs will not be there. It'll kind of be linear, I want to say. this way. So it'll be at the very top. You can just pick any word that says uplift. And then here are all the programs. So you can actually see all the different programs. So if you want to go to the disability billing, when you apply, it's actually going to apply for everything that you could be eligible for. So you would just answer these questions. There's 4 questions up here that you would just go through. So when you're done with the application, let me go to a customer's example. It would look like this. It would be like, okay, they applied for the program. Unfortunately, this customer wasn't disabled, but either this would turn green or yellow. So this customer applied on the 16th, and they're just waiting to be reviewed for these programs, and kind of going from there. And 2, say this customer was like, okay, I applied for the discount. All of a sudden, they do have plumbing issues. These would be ready, and you can just click them when you need plumbing assistance. So that's the program. So if you have any questions or would like to apply, go to your portal account, or you can give us a call.
Okay, thank you so much, Erica. So one of the questions I have for you is, what were some of the areas where you saw individuals with disabilities challenged during the pandemic?
For SALS, so a lot of our customers, were going, month to month, something happened. So one of my very first customers, actually, and I remember her very well. She was elderly, but she was also disabled, and her son was a DJ, and he was, in the nightlife. And, now that when COVID happened, most of those places shut down. So he was not working. So a lot of those people who had night jobs or, small side jobs, they're like, and now I only depend on my disability check. And I had that lady, she was like, my son has always tried to help me. He usually pays all the bills, and now it's just me. So I'm kind of finding those customers who have kind of lost their side jobs, maybe in the nightlife industry, or, at restaurants where they can't be around people because it's not safe for them. Kind of some people had a second job. That's kind of where we're seeing it. A lot of those side jobs have been getting lost. There's just not, downtown, going to, selling flowers, anything, those jobs have kind of stopped now. And so they're just trying to make sure that they can pay their water bill. So we do have the Project Agua funds, which is twice a year that you can get help. Once you do apply for it, you actually don't have to keep going back and applying. So I've already had customers who were affected last year with COVID, and the very first, they've come already around and say, you know what, my bill's gone back up again. I was doing so good, but then something happened. All they do have to do is actually call us and say, okay, those funds are available. We'll apply it on your account. They don't have to apply. They don't have to do anything like that. And then they're still receiving the discount. The discount helps a whole bunch because that's actually taken off from the bill in the very beginning as well. So that's what I'm seeing is a lot of those side jobs have been lost, and we're trying to make sure we have those funds available, and that they know that they can come back and get that assistance if needed.
Okay, great. So we do have a question for you. Someone's asking, do these programs help people in apartments? We pay our water with our rent with a company called Converse.
Okay, so yeah, so unfortunately Converse does not, it is not for in the San Antonio area. So you do have to have a SALS bill. So sometimes the apartments will break them up and actually say, okay, you need to go to the water system and put it in your bill. But we have been getting a lot of apartment complexes where they're saying, I need help with this bill, but the apartment complex breaks it up. So unfortunately, no, we don't help with those types of services, but you can still use our partner agency listing at that sals.org/uplift and get maybe some third-party assistance like St. Vincent de Paul, Methodist Health Care Ministries. Some of those third parties are helping with additional funds for cases like that.
Okay, great. Thank you for taking
There
that.
was just a correction on the name of the company. It was Conserve.
Converse?
Conserve.
Conserve. Okay. Yeah. Which, a lot of apartment complexes do that. They either break it up themselves, divide the bill by how many is in the apartment complex and give it to them, or they say, okay, you're a family of one, maybe your bill should be this, or you're a family of 5, it should be this. That's something SALS does not control. And so unfortunately that it's separately from our billing. So we unfortunately can't, but we have those third-party agencies to kind of help in those cases.
Okay, great.
And what about Miss Marroquin? Do you helping with rent?
Yes, we do help with the rental assistance, and we can even add for this type of utility, where you add it as a commercial utility, and we'll add it to the fees for rental assistance for SALS and not for SALS, but for any type of utility that an apartment charges.
And I would also just add to what's been said already here, that if someone were to be eligible for SAWS Project AWA assistance, but they can't access that because their landlord does not provide them a SAWS bill directly, then they're probably going to be eligible for other kinds of assistance. So we would also like the opportunity to talk to them about their situation and connect them to other resources, including CPS utility, CPS energy utility assistance, for example, and other things that they might not even be thinking about that might be available to help them. And again, our number is 210-206-5372. So that number is 210-206-5372. Thanks.
Okay. So we're also getting a question of all the presenters, if they can put their phone numbers in the chat so it can be screenshot.
Could you say that again?
Basically, they're just asking, can you reply to everyone and just put the phone numbers in the chat so that they can take a picture of it? Yes. For your particular programs.
Oh, reply to all. I'm sorry, I just did to one person here. I'm replying, but did you just see that come in from me?
City of San, yes, it went to.
Okay, great, perfect. Okay, thank you.
So it looks like we have, Texas Legal Aid. We have Human Services. Who else? We have SAWS. Yes, I believe we should have everyone by now. Okay. And so while we have you here, Richard, what are some of the achievements that you guys experienced during the pandemic to serve the local community? Can you speak on that?
Sure. Well, one of the big things is this Benefits Navigator team, which did not exist before, and which we quickly assembled in order to help people with, and I've talked about that during this session. One of the other achievements I would say is continuing to offer the VITA free tax preparation program. Even though it was not safe for folks to get their tax return done across a little table in an enclosed space, the way we are traditionally accustomed to doing it. We did quickly during the pandemic design a new safer option, which is a car line based model. So for folks who need their taxes done, we can help with that, and they can come in their car, they can drop off their documents to us, and we can complete their tax return and call them with any questions that we have, and then they can come and pick up the return when it's completed, and that way they can quickly get their refund. And it also puts them in great shape to be eligible for that the stimulus payments. We want to make sure that if they are eligible, that they get those payments. So those are a couple of the things that we've focused on throughout the pandemic. We also are providing one-on-one free financial counseling for residents who maybe have lost their job or had their hours reduced and are having a hard time trying to figure out how to make their budget work. We do provide one-on-one financial counseling, and we can help them to improve their credit score and to address any charged off accounts or debts that they may have to manage those. So these are some of the things that the Department of Human Services has been working on during the pandemic.
Okay, awesome.
Thanks for asking.
Yes, no, thank you for sharing. Texas Legal Aid, is there anything that you guys would like to share as well? Like some of the things that you guys have been working on or seeing, and some of the, maybe some success stories you've had?
I think most of them have been in the area of housing. So I'm going to defer to Enrique to talk about more of the housing issues that we're seeing, because he works with that team. But I was going to say one more thing about ID recovery, and that is with the passage of the federal law, the Real ID law, that it's now required that you have a certified birth certificate. So we work with the San Antonio Project, where we have homeless people who can't get a birth certificate because they don't have a certified copy of their birth certificate, and they're from out of state. And in order to get an out-of-state birth certificate, you have to have a lawyer. And if you're homeless, you can't afford to hire a lawyer. So there's been a huge need to help people get their birth certificates so they can get an ID, so they can, have access to social services, because without an ID, you really can't get anything. So.
How long does that process usually take?
Start to finish, it's about a month, maybe 6 weeks, depending on the out-of-state agency. So,
okay, so there's like a lot of collaboration and coordination trying to get everything, all the documentations that's needed.
You were really lucky in San Antonio to have Project Hope, which is basically run by SAPD, and it's a couple of guys who sit out there and talk to homeless people all day and help the ones who need access to IDs. And so they get the intake and they send it to us, and then we submit the application to the out-of-state agency. And so we're able to get them an ID in Texas. Otherwise they wouldn't be able to get one because of the harsh federal laws that were passed. So.
Okay. Well, it sounds like you guys are doing a lot to alleviate some of the stress, especially during this pandemic. Because a lot of people, of course, are experiencing hardships right now. So I really appreciate all the presenters for being on and sharing your program's information and the resources that are available to help the citizens. We appreciate the work that you guys do.
Thank you.
Thank you, guys.
Thank
And
you.
I believe there's one question before we switch out of the room. It says, my husband and I don't drive, and we spent several days calling and leaving messages for someone from VITA to call us back. Unfortunately, we had to pay out of pocket this year at H&R Block. Last year, we filed via email with VITA. Can you provide a good number for next year for VITA, please?
Okay, so let me give you two things. So one thing is that you can the easiest way actually is by internet, if that's possible for you. And I'm going to put that in here. The VITA free tax preparation program. is at www.vitasa.org.
Our room is closing in about 45 seconds.
Oh, thank you for having us. I appreciate the opportunity to connect with the community. It's been a long year sitting in front of computers, so this is as close to human contact as we get these days.
Right, right. No, we really appreciate you guys for taking time out, especially, you know, it's late in the evening. So your dedication to helping the citizens is basically.
All right, welcome back to the main room. We are going to just take a few minutes to wrap up and reflect on our conversations this evening and the data that was presented at the beginning of the discussion tonight. And our work here is not done. We have a lot of work to do to move our community forward to a place where the issues that people with disabilities saw increased impact over and above the rest of the general population during the pandemic need to be addressed, and solutions and progress need to be made. And so we'd like to conclude tonight with everybody just feel free to take your unmute yourself and add to the conversation of if you wanted our community leaders to hear one thing about your experience as part of the disability community during COVID-19 pandemic over the last year, what would that one thing be? And when I'm talking about the disability community, you can be the person living with a disability, caring for a person with a disability, teaching a person with a disability. The disability community includes all of us here as advocates tonight as well. So if you could tell our community leaders one thing, or you would like them to hear one thing, what would that be? You can put your answer in the chat. You can verbally respond, or you can email your response to that last question to advocacy@disabilitysa.org. Anybody want to reflect?
You know me, Melanie, I'm always ready to talk.
Go ahead.
I apologize to the first group with Emily and all. She gave me the floor and I took way too long. This is going to be 30 seconds or less, I promise. What I learned most over this COVID period is, first of all, how needy, and I say that as in I'm needy and we're all needy, and we all need social interaction, right? So our clients, thank you, Jennifer. Our clients so needed it. And so we did our best. We did our best without, and I was in the classroom there for the digital piece. But we tried not to do digital, right? We tried to stay with the clients who wanted to meet, those who wanted to do sports and all that stuff. And so we tried to focus on that as best we could, given the constraints. But the important thing that I found, Melanie, that was beautiful was our clients, and particularly those with Downs. And as you know, Downs is the most vulnerable of our population as far as genetics and susceptibility is concerned. And they, with the help of their parents, it wasn't just them, right? It was their family members, wanted so badly to get out and interact. You know, I'm a jobs guy, and whether it's sports or jobs, it's all interacting and being part of society. And I learned how beautiful our community is, and that they want exactly the same thing we did. And there's no differentiation between any of us on this earth, right? And they just wanted to get out and communicate with people. And the more that we can give them that opportunity, even we have to do it judiciously, right? But that's the bottom line. And I'm just amazed at how many of my clients, and during COVID, I was able to help place in a great job in San Antonio about 150 clients in the last year, right? That's a lot in 1 year. A lot of those was the Amazon and other companies, but they just wanted to get out there. And I was so happy to help them get out there and be a part of the community, even during this difficult time.
Thank you, Todd.
Melanie, we have a conversation in the chat from Jennifer West from Texas Regional Parasports. She states, keeping people connected is key. Focusing on how we disseminate the information on how they connect is key.
Yes, I saw that definitely. Is there anybody else who would like to chime in and share just their thoughts that they would like community leaders to hear about their experience? Again, feel free to put your response in the chat, unmute and verbally respond, or feel free to email us your response at advocacy@disabilitysa.org.
Hey, Melanie, it's Ryan.
Hey, Ryan.
Hey, I think the big thing, and you and I talked about this, I think, way last year, and some of the things we were talking about with different outlets, with the media approaching you. Just in reflecting back, I think the biggest thing the authorities, powers that be, those in decision making need to know is, I think, just to, again, the communication piece and reaching out, whether it's through organizations like you, but to get to those of us who have disabilities, and meeting the basic needs. And I think the social piece too is so important. But how do I get food? How do I just get those basic needs met? I think that was a struggle that we had early on in the pandemic and some of the different times throughout the last year. Getting like the HEB stuff.
Yep.
Line.
I remember that.
We have another comment from Roger Satterfield from Straps. Being consistent in any organization or affiliation with how we move forward from the pandemic. And I actually have a question for you, Audrey, if you'd either like to chat, type the answer in the chat, or if you'd like to unmute. What do you mean by being consistent?
All right, can you hear me?
Yes.
Okay. So I guess what I mean by that is just because all of the organizations that I talked with or met today, we are all coming from different kind of areas, but we all work for those with disabilities, and just kind of being consistent across the board with how we want to advocate or how we want to just kind of move forward is, I guess, kind of what I'm trying to say, is being consistent that way that disseminating that information is all consistent. Does that make sense? Yeah.
Yes.
That's kind of where I was trying to go with that.
Okay. Thank you.
You're welcome.
Hey there. I don't know if there's a hand to raise, but this is Emily from Vocational Rehab, and one of the things that kind of stuck out to me is, leveraging things like this, our collaboration and our partners that are all focusing on, fighting the good fight, right? And trying to assist individuals in, San Antonio who have disabilities, but really leveraging those relationships because, at VR, we're focused on employment, but we have to remember to meet people where they are during this time. They might not be ready to look for work. And so really leveraging the relationships and working with people that are on these calls today that are focused on food and shelter and clothing and those types of things was really important. Things like bare necessities and just different platforms that we might be aware of, but again, sometimes our folks are really just focused on, that employment piece, but we really had to slow down. And again, just remember to meet people where they are and leverage those relationships and maybe pause on the employment for a little bit until some of the foundational stuff could get taken care of. So this is kind of something that I walked away with.
Thank you.
I absolutely agree with that. And I think that's why this is so great, Melanie, and I appreciate y'all putting this together is right. We get siloed into what we do for our clients. And I think the way we can best serve them is being better educated on what everybody does in the community for our clients.
Absolutely.
So things like this, I just love meeting new people and learning about the different resources that I can share with my participants out in the community is my biggest takeaway, and more important than ever, right, during this pandemic.
Yes, definitely. Hi, I'm Adriana from the Texas Autism Society, and I was thinking the same thing, just seeing all these organizations working together, and hopefully these partnerships can stay longer. I think in our small group we're talking about that, on how we can create these interactions, and hopefully it's something that can go forward after this pandemic gets in a better place.
So I don't know if this is the really an appropriate place to share this, because I don't know that local communities have any power over the use of telemedicine. That seems like more of a federal and insurance issue, but telemedicine is one of the best things that's ever happened to me. So I just thought I'd mention that, because that's something that happened with the advent of COVID. I may be unusual as a disabled person. I became disabled with Ehlers-Danlos syndrome, which is a rare disease that causes faulty collagen. It's a genetic disorder, but it didn't really start bothering me until 2014. And I went from working like 80 hours a week to not being able to work at all in 4 years. But in addition to that, I also collect autoimmune diseases, right? Like I've got type 1 diabetes and Crohn's disease and asthma and hypothyroidism and all of this other stuff. And the bottom line is that my healthcare had become a full-time job. And until the advent of telemedicine, I didn't realize what a burden it had become. Because I went to the doctor probably 2 weeks on average. Sometimes my doctor's appointments would last 3 hours, and then there'd be a half-hour commute time on each end of that. And it's like when all of that stopped for a year, all of a sudden I had all of this time that I had never had before. And it took so much of my stress away not to have to spend 4 hours 2-3 times a week on average going back and forth to the doctor. And so anyway, I just wanted to mention that, like, I sure hope insurance companies keep paying for it, because it has made my life so much better.
Yeah, and I think, just so you know, I think you're right that as long as insurance companies are willing to pay for telehealth visits, telehealth and telemedicine will continue to move forward and grow. And so in some ways it's kind of that legislative insurance company conversation. But I think knowing that has, I really find your story that you realized you didn't have this burden until you had this option. I find that a very powerful statement that I think I'm going to have to process a little bit with that conversation.
Okay.
Because I think it says a lot about these unintended consequences and barriers of just someone who lives with a disability. There's been some research about people who have a disability, just it automatically costs more to be a person living with a disability, because you have more kind of what would be considered an essential need, i.e. healthcare or durable medical equipment. But it'd be interesting to see if there's any research related to kind of these additional burdens, like you were talking about, travel time and things like that.
Yeah, I've actually recently gotten a new PCP, because everybody always thinks diabetes is my biggest problem, but it's actually the least of my problems. I've always had it under good control. I have no complications, and yet my former PCP would not allow me to manage my own diabetes. And it's like, well, what happened to patient self-determination and informed consent and autonomy? Apparently, if you're type 1 diabetic, you don't have that. Like, she wanted to force me to see an endocrinologist. And I just kept telling her, look, I already spend $10,000 a year on my healthcare. I already spend a full-time job worth of time on my healthcare. Like, I don't need an endocrinologist to manage my diabetes. I've already been doing it on my own for 32 years. And she just couldn't understand that, what a burden my healthcare had become. And the fact that just eliminating an endocrinologist would help me, but she wouldn't do it. So anyway, I'm sorry, I'm venting now, which is not the subject of this presentation, but anyway.
Yeah. And like I said, you can always, email advocacy@disabilitysa.org and kind of share some of more of these conversations related to healthcare burdens, because I think that will help Melanie, myself, and some of the other organizations really kind of take a look at, like I said, kind of these strategic ideas on how we can do better. And if we're not understanding where the challenges and the burdens really are, we're not going to do strategic planning well. So please feel free to share.
So just jumping back, Emily said, the ability to connect and phone a friend was something that she wanted to make sure, people still had access to. Emily, and anything you want to expand on with that?
I know. I was just, kind of just saying, like, being able for us to network and, if I need to phone, someone from their nonprofit, just being able to learn and phone the firm, like, hey, I need shelter resources has been great. So, and thank you for responding. I'm happy to put our information on any listservs, or if anybody, if there's a document that we can share to have to reach out. And I love the bare necessities, but I don't always know who is behind that.
So I misunderstood your question. So yes, for especially disability service providers, just know that Disability SA hosts a Facebook group specifically for disability service providers, where we put out information that is relevant to the community and to the people that you're serving. And it's a place to share information as well. We keep a tight ship, right? So it's not, you can introduce yourself, but you don't market yourself. You don't post fundraisers, right? It's just information that would help bring the community together and strengthen the other organizations. So if you're interested in that, please feel free to reach out and get involved. And then also know that Disability SA exists as a connector in the community, and we have friends and reach in all 4 of the disability sectors, from sensory to cognitive to physical and mental health. And if there is a resource that you haven't been able to find, give us an opportunity to see if either we or the reach that we have has access to the services that you're looking for. During the pandemic, we got calls from rodents in the attic to, needing help with filling out Social Security papers. So it kind of spanned a very wide range of things that people with disabilities were looking for. And I think we were able to help most of them find something to assist. So definitely the networking, I love that. Did I miss any?
Yeah, it looks like just to some of the chat functions, I think Richard shared some Vita tax preparation information, and Angela shared her phone number, so if you need Warm Springs connectability information. And we've been asked if there's going to be a list of organizations with emails and phone contacts. Melanie is going to have all of that information. And just so you guys know, we're also looking at this as kind of a first step, because we know we need to work with the community and we need to work with organizations on how we move forward, addressing the challenges that our community is serving. And so I'm sure there will be some future conversations around this topic and kind of how it morphs in the future. wherever it takes us over the next year.
With all the hope that it's going to take us forward, right? Because our community needs to continue to move forward, and we're looking forward to seeing how that happens. So for those of you who work at disability service organizations, just keep an eye out for future requests for information and inputs. And we will continue to make sure that our community leaders know that people with disabilities are here in the community. They need to be taken into consideration at the beginning of planning efforts, and that by doing so, we'll have a much more a more thriving community for people to live in. So thank y'all for your time tonight. We appreciate you coming and participating, offering your information, offering your questions, and being part of a community that comes together, whether you live with a disability or you don't, to talk about the issues that impact people with disabilities in our community and how we can each take a role in moving our San Antonio forward. So on that, our traditional Conversation 360 partners are the partners, Texas Resource Network, sorry. Inclusion is Sweet, and the EcoCentro of San Antonio. And together we host and put on these conversations traditionally every other month, and we throw in a one-off here and there, but our next one coming up will be on public safety on June 1st. So public safety and disability on June 1st. And so we hope you all will return, whether you're returning as a facilitator or a guest to just participate in the conversation. We want your voice at the table. So have a wonderful evening and take care.
Thank you.
Thank you.
Thank you, Mel. Thank you, Anna.
Thanks, Melanie.
God bless y'all.
Thank you.
Thank you, Melanie.
Thank you, guys.
And Jennifer, I see your hand is, okay, guess not. I guess it was a late raise. I saw her hand raised and I just want to make sure she didn't have a last minute question.
Oh, I'm sharing my screen, so I don't see any of the little like people faces.
I know. It's really hard when you share your screen. I'm gonna go.
Angela, are you like doing it in the dark tonight, hun? Mood lighting? Bye.
Bye.
Adriana, I'm so sorry. Well, bye.
Bye. This was fun. Thank you. I'm glad
Thank you for helping out, Shauna. We certainly appreciate it. And I hope you'll be back one way or another as a volunteer or an attendee. All voices are welcome at the table. So
sounds good. Thank you. Yeah, have a good evening.
You too. Good night.
Bye.
Bye.